Hi everyone, I chose to report on pet therapy this week as it's something I'm very interested in and have experienced firsthand. Pet therapy is the use of animals to benefit patients in a healthcare setting. I've seen it personally in a hospital, but animals can be used for different things such as therapy, activities, or interventions. Every Wednesday, a volunteer brings a dog by the emergency department that I'm currently in, and it's basically there for an informal visit with the staff and with the patients. I think this is a great service because it gives me a minute to just relax, take some time for myself and pet a dog, which is a great distraction from everything I go through in the emergency department that day. The dog's also available for physical therapists if they want to walk a patient. Usually patients are very responsive to walking with a dog or throwing a ball for the dog to go fetch for them, which I think is pretty cool because it gets that shoulder motion or whatever they need to be working on. But animal therapy is a very broad subject. Generally, it's a dog that we're working with because there's a risk for injury or illness to the patient with other animal visits, such as cats or rabbits or anything like that. But there are risks to the visit, like anything, such as possible transmission of zoonotic diseases and allergies to animal dander. There are also things such as tripping over the dog walking into a piece of equipment they shouldn't be walking into. So these dogs go under special training in order to work with our patients in the hospital. However, studies have shown the benefits to animal therapy far outweigh the risk to animal therapy. Benefits include providing stress and anxiety relief in patients as well as their visitors. Animal visits are also shown to reduce pain in children, post-operative patients, and physical therapy patients. This was measured by using a pain relief scale before the visit and after the visit. There were a variety of pain scales used, as children sometimes can't use the numeric pain scale. Usually they use faces or flat scales for them. This was measured, and then also a range of studies shows that a decrease in blood pressure and an increase in oxygen saturation was noted after a visit with an animal in both pediatric populations and long-term stay populations. So anyone who was in the hospital for a long amount of time benefited from those animal visits as well. Adult inpatient populations are the only population where there seems to be a mixed result there. The only for sure study that I found was in a mental health adult inpatient population. They found after 4 weeks of an informal visit with an animal during therapy sessions, as opposed to a standard therapy session, the patients who met with the animal were less anxious and improved their socialization skills. Of course, there are critiques to these results, as animal lovers may skew their results towards the animal therapy since they feel that it's beneficial. And it's also unclear whether the improvement in status is due to the animal, the handler, or the increase in attention to the patient. There was also an interesting point made in the articles that I read that studies must be done to determine how the visits affect the animals that are being used, as it should be a mutually beneficial relationship. Technology is also improving ways that we can study exactly how these animal visits change our neurologic status by testing cortisol in our saliva as well as oxytocin, and there have been moves towards a functional MRI scan during the visit to see how it affects our brains. It'll be interesting to see how animal visits change in the next couple of years, as it's a relatively new practice in hospitals. And I'll link all my articles that I use down below so you guys can see them too. Thanks.